guys, Dr. Lavan. So this is going to be our third and final part of our series with our expert patient Julian. If you remember, Julian had his knee operation, his knee replacement surgery, where in video 1 he kindly told us about the procedure and the do's and don'ts. We've also done a video on medical hacks, and those were 2 tricks he actually taught us, which not only would help in normal surgery of the knee, but also in other surgeries. And this final video is really focusing on that prehab and rehabilitation afterwards. And that's by actually doing some really good exercises to strengthen our knee, typically by improving the strength of our quadricep muscle. And we should be able to teach you these with the help of Julian, so that before any kind of procedure you want to take part for your knee, you could improve the quality of your life after the procedure by making these muscles stronger. So we're going to be showing you these right now.
So the first exercise I do is kind of a blood pump, I think. So you do sort of 15 of those. And you can do these all day long, which is really good because it will get the blood flowing, which obviously is healing, but it will stop DVT, and we don't want to get that. So plenty of those. The next one is to activate your quads. So I pull that up, I pull my toe up, and I straighten my knee. Like what I'm trying to do is that. As you can see, it's quite bent at the moment. This is quite common. So I do 10 of those. And what you're trying to do is there's a gap underneath and you're trying to close the gap. The next exercise I do on the same sort of thing is I pull that up, I tense the quad muscle and I lift the leg up. Now that's quite a hard one to do, and you could get a bit of a shooting pain which hurts, but with all these exercises sometimes the pain gets to, like it can get to a 9, but it goes quickly. So with that one, sometimes it can shoot through the roof. It's much better now, and I'm on day 12. It's much better, but it is still painful, but it stops quite quickly. So if you can do 5 of those, then that would be a really good thing to do. The next exercise is to get some bend. So you can use your hand, because you're not trying to build up a muscle, you're just trying to bend it. And if you're on something smooth, that can help as well. And just do that as well. And you can feel it gets tight, and then when it gets tight and it hurts a bit, I just do it a little bit more. Hold it, and relax it. And you do 10 of those. All these exercises I'm supposed to do 4 times a day. The next exercise is the most important one and my biggest regret pre-operatively. So prehab, if you can't straighten your leg, you need to do this. So you put your heel under something a bit high, so there's quite a bit of space under here. A bit spongy, but it doesn't matter. You do the first exercise where the toes come up and you activate the quads, and you put a bit of weight. Doesn't matter how much, just a little bit of weight on it, and you try and push it down. If you were in an operating theatre and they had to manipulate this, which if you don't do this exercise they might have to, you would find that the doctor would easily be able to get this straight. The reason I can't is because it hurts. You have to a certain extent overcome that, and it may take a month or 2 to be able to do this. You just do this. The other thing as well is what you can do during the day is just leave your heel up and your middle leg and your knee dangling, putting some just gravity, and that will be helping as well towards it, and you can do that any type of day. But it is very uncomfortable and it is very painful, but once I've stopped, it's gone. So push on.